Core TV News, expanding your view.
Let's get to the last laps of our independent special show, Radio and Core TV News, and now we're talking health. We're joined by Dr. Olusegun Akinwotu, who is the second vice chairman of the Nigerian Medical Association Lagos State Chapter, as well as president, resident doctors, Federal Neuropsychiatric Hospital, Yaba, Lagos. Good morning and happy Independence Day.
Happy Independence to you too. Good morning.
Good to have you join us.
Thank you very
All right, let's start from the basis of it all. How do you think the health sector of this nation has fared thus far since independence?
Talking about the health sector, yes, over the years there's been some little improvement as compared to what we had in the 80s, since independence. Sorry, since the democracy started in 99.
Okay.
Some little more commitment of some funds to improve the healthcare services was seen. But however, that is still abysmally low compared to what we expect when we talk in terms of international best practices in the healthcare delivery system. For example, the National Health Policy is not been adopted or probably enacted by the National Assembly. And this is required to ensure that every Nigerian benefits from the healthcare provision as expected, because the policy's target is to ensure that there's comprehensive healthcare delivery based on primary healthcare system, to ensure we have protective, promotive, preventive, restorative and rehabilitative healthcare system, which makes every individual and the communities have access to adequate healthcare service, and at the same time they are able to show they are productive enough, they have some degree of social comportments, social achievements and improved quality of life as a whole, based on resources of the nation. And you can now see what I'm trying to say. If you look at the resources of our country and all I've listed now, how apart are they with each other?
It's all right. Just recently, Nigeria had, unfortunately, its first Ebola case. How would you rate our reaction and our efforts over this period of time, health-wise?
Yes, we were swiftly able to contain the Ebola spread.
Though you were on strike then.
Because, yes, despite the fact that we were on strike, we were also involved in the management of the Ebola scourge, both at all levels, really. And there are certain policies in place. As I said, since democracy, there's been some improvement in the healthcare sector, but it's still a far cry from what it's supposed to be. We still need to do more. A lot of funds still need to be put in place to ensure that adequate investments in both facilities and human resources is actually achieved.
Let's talk about the attitude of medical personnel, even to their jobs. Recently, you came back from a strike, and even the Lagos NMA is saying that Lagos State has not complied with the agreement that was reached. An ordinary person would think a doctor is still well paid compared to other sectors of the economy. Because I remember vividly when I was 7, I envied medical students when a copper, the same as I am, was paid 70,000, 80,000, and I was paid 5,000. So what's the moral justification for going on strike and in asking for allowances?
Well, the major purpose of that strike was not for increment in allowances.
But was part of it?
It wasn't part of it. We didn't ask for any new increments. None at all. Be educated on the fact that the strike was called basically for clinical governance. There were aspects of the healthcare systems that are actually meant to be for just those who have basic MBBS, medical training in the medical, those who went to medical school primarily. And if those who don't have those training are trying to say yes, they also want to attach or be in those positions, it's going to cause chaos in the long run. We spoke extensively about that when I was here. So the purpose of the strike wasn't primarily because it was just erosion of the areas that are meant to be
But
for
your
doctors.
emergency allowance obviously
Exactly.
was part of it.
Was
Because
part of
I can
it.
recall you said that
the hazard,
doctors,
there was
hazard
wait,
allowance.
Hazard allowance was it's 5,000. There is no health insurance for anybody. So you look at that. If somebody, like I gave an example on air then, a colleague of mine in January was trying to set a line for a patient, and this patient was HIV positive, and somehow in the course of a restless psychiatric patient, the needle she was trying to use pricked her. 6 months pregnancy, she had to be taking antiretrovirals. How do you explain that? The hazards on the job are much. Whether any aspect of medicine, any aspect, even if you're in the pathology lab, you're trying to work on samples, anything can happen. So you should check what you're doing compared to other parts of the world.
But
How?
okay, well, look, let me just quickly, because we have to ask you so many questions within a very short period of time. What's the situation of things now between the Lagos NMA and the state government? Because the last time we had, you were talking about unpaid salaries.
Yes, it's there was a strike, and following the strike, part of from negotiations was that okay, nobody will be victimized, and everybody should go back to work. And even the federal, that even at some point also sacked resident doctors and called them back, even after a week the strike was called off, had paid by now. But Lagos State didn't pay August salary, and we even had somehow September salary seems not to have been paid yet, and we are wondering other states have paid, and we don't understand the reason why Lagos State.
But is Lagos State saying Lagos is not paying, or maybe they have financial incapabilities for the moment?
What they've said so far is that they are not going to pay.
You had a meeting with the stakeholders yesterday.
Yes,
what was the
at the end of the meeting we held so far, they said there should still be negotiations. We should follow certain modalities to see how we can achieve results. So let us try and explore those channels they have set now. But it's it should be noted that judiciary went on strike in the same state. Be noted that teachers went on strike. Last year there was about 6-7 months ASU strike. Lagos State was involved. LASU was closed. They were not working, and all these people got paid. So we are wondering why doctors in Lagos State have been isolated for this kind of victimization.
I will still go back to the issue of personnel, a situation whereby consultants at public outfits, hospitals rather, have their own private hospitals, and the allegations of visiting a public hospital and you refer to a private one. Is that not, how do we justify the input of manpower that is required in public hospitals?
Well, to my knowledge, when a patient visits a government hospital, at least in the setting where I work, the patients are attended to within all that is available, both human resources and infrastructure. But when there are some facilities, for example, in my hospital right now, we deal with mental issues. Sometimes you need to check the brain, you need to do an MRI or CT scan. You have to refer the patient out. And when you do refer such a patient out, the patient usually comes back with the results because the expert is there. If there are certain cases where a patient, in probably some other hospitals, where the best services required by that patient's condition can be better managed in a private setting where there are other facilities that cannot be found in that hospital. For example, we have government hospitals where the CT scan is not working, the MRI is not working, and the patient, by the time you are moving a patient who, for example, has a cerebrovascular accident, who is already in coma, from a private laboratory or private diagnostic center, maybe somewhere in Surulere, and taking him back to LASUT, you can understand the rigors involved. So sometimes the requirement of that patient's management may require that kind of referral. That kind of situation happens so that you can, in the same place, get that facility and at the same time. So you refer, it's not as if it's referring to his own. But
I'm sure that you'll be a chance to join us subsequently in the course of this week so that we can discuss all of these issues more extensively. But just before we let you go now, in a minute, what do you think can be done as Nigeria celebrates 54 years of independence to revitalize the health sector?
First, we want to advocate that the National Assembly, the executive arm, should put pressure on the National Assembly through every means to ensure they pass the National Health Bill. If that is passed, at all tiers of healthcare delivery, primary, secondary, tertiary, and all tiers of government, Nigerians will be better, they will have better access to affordable quality healthcare if that is passed, because it will require more funds being allocated to the healthcare unit. And at the same time, we also want there to be proper health insurance. If we can do more in terms of national health insurance.
To serve